Good afternoon, everyone, and thank you for joining. We'll just wait a second for a few more people to join, and then we'll get started. Okay, thank you very much, everyone, for coming on what's a really warm day, I think, across the whole of the UK. So well done for persisting. And yeah, this should be a really good discussion. We're delighted to have secured a headline sponsor for this event, which is WEMA. We've got to know Vivek and Rohit quite well over the last few months. And yeah, it's great to attract these sponsors because they make our work a bit more sustainable, and it's really nice to have everyone involved. Just to begin with, I'm going to give a little overview of Future Care Capital. So first and foremost, we're a charity and research organisation, and we have about a 70-year history. And we bring together policymakers, practitioners, and act on behalf of our beneficiaries, which is everyone in receipt of health and social care in the UK. We operate across 5 priority areas, so data, technology, innovation, climate, and investment. And a lot of the work that you'll see today is part of our technology pillar. And this is the second installment of that series of research. And we're delighted to have Chris here with us, who is from New Market Strategy. And we'll get on to a bit more detail of the project itself in a couple of minutes. So if we go to the next slide, we're really lucky to have a huge number of really great collaborators and partners, and our work has been featured in a lot of news outlets, and yeah, we end up kind of punching above our weight in terms of the amount that we can achieve as a very small team, and it's our collaborators and the associates that we work with that really allow us to do this. So if we move on to the agenda, what we're going to do is initially have a brief presentation of the research itself that will be split between me and Chris, and then we'll move on to a panel discussion to focus on some of the information in the report, but then also to provide that wider context and really raise the debate and see where things need to go and where we can take them. So I just want to introduce the speakers now. If we go to the next slide. Yep, so we've got Vivek, who's from WEMA, and Chris is from New Market, who's our research partner. Celia is from eCrew, and Dan is from Wellgood. What I think we'll do initially is if each of you want to introduce yourself briefly, I'll limit this to a minute or so, just so you can give an overview of who you are and what your company does. So just in the order of when on my screen, I'll go Dan first.
Thanks, Peter. So hi there, I'm Dan. I'm one of the co-founders of Wellgood. We are an employee engagement and happiness tool for the workplace, where we look to prevent mental health crisis. We've been running for about 2 years now, and are really fortunate to work cross-sector amongst numerous industries, including charities, digital agencies, education, as well as housing, of all things. And what we do is really simple. We take away burden from employees, and the burden that is often bestowed upon them around mental health, and actually place that responsibility back onto employers to be able to act on their duty of care, basically. So that's me in a nutshell. On top of that, I am also ambassador for Mind, so the largest charity in the UK around mental health.
Lovely, thank you, Dan. And if we move next to Vivek.
Hi everyone, and thanks as well for that intro previously, Peter. So I'm Vivek Patney, the CEO of WEMA. WEMA's focus is really to support the informal care and working carer challenges within the workplace, specifically directed towards corporates and connecting their employees with the most appropriate types of services that they need for themselves or for their loved ones. And that covers everything from elderly social care through to mental health, through to well-being, through to community-based services, really with the aim of alleviating that burden and pressure of having to manage your family care responsibilities whilst also working, and the effects that has on productivity, business output, mental health, and everything else around that. So look forward to discussing that with you all today. Thanks.
Thanks, Vivek. And then next is Chris.
Sure. Hi, everyone. My name is Chris. I'm a consultant in new market strategy. And as Peter mentioned, I was the research lead for this project. I have a background in market access in digital and medicines and have spent a lot of time understanding the barriers and enablers of digital innovation spread in the NHS. New Market Strategy is a specialist UK consultancy dedicated to improving access to health innovation through regulatory, policy, and market entry expertise. So that's me. Really looking forward to kick off.
Lovely, thank you. And last but by no means least, Silvia.
Yes, hi, thank you so much for having me. My name is Silvia Litvin. I'm a clinical psychologist and founder of Psychoeducation, the company behind EQ, the emotional health game. And we designed an evidence-based application that builds resilience and treats low-level depression and anxiety, and realized the very hard way by not having clients that digital apps are really challenged by drop-off rates. So we figured that we had to find a way to get young adults, which is our target audience, anyone between, let's say, 18 and 35, to stick to digital prevention and early intervention interventions. And we did that by using the know-how of the gaming industry. So we are now an evidence-based game. We have over 300,000 downloads internationally, partnered with Unilever, Mental Health America, and many more. And now we're trying to onboard corporates to understand that you don't want to act when it's already too late and people are struggling with mental illness, but give them tools to be able to deal with life challenges while they occur or before they occur.
Lovely, thank you. We're really lucky to have all of these panelists. I think it's going to be a really, really good discussion when we get there. So if we go to the next slide, this research that we've done has been conducted basically as part of a series since the beginning of the year. The first installment, if we go to the next slide, was on home care, and in that installment we mapped out the adult social care environment, and throughout the year we're going to be looking at these different areas of adult social care. Mental health care is an interesting one because it kind of sits partway between healthcare and social care, and there's a lot of overlap of different pathways and needs. So it's been quite an interesting piece of research to conduct from that perspective, particularly when we were looking at the companies themselves and how to segment them and exactly what they were doing, how it fitted in both the well-being picture, the care picture, and the healthcare picture overall. So if we go to the next slide. In the previous report, we set out this technology stack where we think from the ground up, starting with providers and their governance processes and needs around cybersecurity. It then goes into the infrastructure itself and how you provide that digital backbone to build solutions on. So whether that's basic broadband provision or starting to think of 5G technology slightly further down the line. We'll come on to that a little bit later because that relates to some of the findings of the previous work, but not necessarily to this piece, which is quite interesting. And then at the top, we have this interact layer, which is where you have all the technologies that we're talking about today, which is the ones that analyze and that you get information out of and you can interact with, whether that's directly to use the tools or whether it's part of a game. So yeah, there's a lot to unpack here. And I'm going to hand over to Chris now, who is going to start talking through some of the findings. Thank you.
Great, thank you, Peter. So for this specific piece of research, there were three things that we were trying to do. We were trying to provide a snapshot of the technologies, mental health technologies in development in England, understand trends in mental health care tech pre and post-COVID, and the opportunity for technology post-COVID as well. Now, according to the criteria that we had, we found 56 companies in total, which was actually less than we originally expected. And it might be interesting to consider why that might be the case in the discussion. It's clear that there are lots of small companies that are doing some really interesting things, but most of the technologies that are being developed are actually consumer technologies. And as you can see from the breakdown on the screen, most of them are actually applications. So it might not be the case that you can say the mental health care market is an ecosystem of its own right at the moment. It appears to be that applications are a spearhead product. So they are driving innovation and funding in this space, and we would expect that the types of technologies that are being developed will diversify over time as the market matures. In this map, you can also see where the different technology solutions are being developed. You can see a couple of innovation hubs, which interestingly align quite well to the areas that have some of the longest mental health waiting lists and where there has been the biggest disruption due to COVID. And finally, in terms of funding, it is comparable to other healthcare niches. It is certainly a lot more than for the previous home care report installment, showing that there is sustained interest in mental health care and opportunity for the sector to grow further. If we can just move to the next slide, please. So as Peter mentioned, we spent a lot of time trying to figure out how to categorize the different technologies that we found according by function, and went through several iterations. And we ended up deciding on 4 categories, which I'm going to very briefly talk through now. The first is token therapies. So that includes anything to do with two-way communication between users and healthcare professionals. For example, Wiser would enable you to have a counseling session through your phone. Then you have non-token therapies, which are basically therapeutic interventions where you are not communicating with another human. And as an example, we have EQ, which is also one of our panelists here, obviously, which is an evidence-based game to tackle anxiety and mental health. And non-token therapies is where we see some really interesting uses of technology, actually. For active monitoring, straightforward mood trackers, symptom diaries that are shared with healthcare practitioners. And for productivity tools, we included anything that helped to drive efficiency for mental health workers specifically. So for example, Thalamus provided easy access to some specific forms used in mental health care, and Holmus helped with caseload management and triaging of patients. Now, the reason why we used a Venn diagram was to reflect that this categorization wasn't always clear, that there are blurred lines between the technologies, and that sometimes they're used for multiple purposes. Obviously, a lot of thinking went into this, but if anyone has any insight on how it can be improved or any challenges, we'd be very happy to discuss that in the discussion as well. If we can go to the next slide, please. In terms of the take-home messages, I guess one of our biggest insights, as we suspected, is that there are really good opportunities for mental health technology to be used to support patients, the NHS workforce, and the health service, particularly post-COVID. One of the areas where there seems to be a particularly large opportunity is in preventative solutions, because for the next 12 to 18 months, the health service is probably going to be focused on recovery and crisis management, focusing on the most severe patients, and may not have the capacity to work on those sorts of activities. One of the things that we didn't necessarily expect is that most of the technologies that we found are replicating or scaling existing models of care, rather than exploring new complementary ways of providing care. Now, this is not necessarily a bad thing, and there is huge value in being able to do that. But there are some gaps, and there is an opportunity for further exploration. And so part of what the report actually did is suggest areas where further research could happen. For example, it might be that a diagnostic technology or targeted screening programs for at-risk populations or particular demographic groups would be particularly helpful. At this point, we have established that there is room for growth when it comes to mental health tech in England. And if we think of how to progress that, a collaborative approach that involves clinicians and end users is going to be incredibly important to make sure that technologies are being developed to respond to system and user needs. That may seem like a really obvious observation, but if you want to create a product that is accessible and that is usable, you need to include the people that are actually going to use it in their daily life in the development of the product. And finally, one of the other things that we found is that there is scope for targeted support and intervention, which is not just funding, to help grow this sector. And in particular, a bespoke assessment mechanism for digital technologies at a national level would be very valuable to help ensure that the right type of technologies are being developed and for users to know that the technologies they use are evidence-based. Now, there were plenty of other interesting findings of the report, so if you haven't read it already, I would definitely encourage you to do so. But those are the take-home messages, and I'm going to hand back to Peter now.
Oh, thank you, Chris. So Newmarket are a new partner for us, and it's been really interesting and exciting working with them on this. They're a really, really strong team for this project, so thank you for all your work. We'll be moving into the discussion in a minute, and at Future Care Capital, we have this evolving concept of the future fit-for-purpose health and care system. So we'll be thinking about the wider context of health and care here, and thinking about how the technologies we've seen through this report make sense as part of that. Are they adequate? Do we need to come up with completely new models of care and technology itself as part of this future? And I think it's always very useful to think about whether the technology is the right solution, and that will definitely form part of our discussion. We had a very interesting discussion with Professor Simon Wesley as part of this whole process, and his foreword really highlights a lot of the considerations around those sorts of questions. And obviously there's the COVID question that we'll be touching on. I think everyone will have experienced COVID in different ways, and there will definitely be lasting effects from that. And we need to make sure that we're providing the right care, and whether that's healthcare or social care, we need to really ensure that we're not just using technology as a potential cure-all, and that actually the solutions that we need are the ones that are being implemented. So we move to the next slide. I just wanted to say, if anyone had any feedback on the research or wanted to get in touch about what we're doing, please do feel free to email me or tweet at us and get in touch, because yeah, we always want to challenge our ideas, come up with new ones, and that's what these events are all about. So we move on to the next slide. I think if we stop sharing, we'll go to the panel discussion. Lovely. So yeah, it's been a really interesting piece of research to do and to look through the findings. I think the main thing that I'd like to open with is it seems like a very, very small niche of companies. We saw this before with home care, but then for mental health technology, I think we were expecting there to be a lot more out there, particularly in relation to lots of different contexts, and we were expecting to see very specific forms of technology as well. So whether that's for particular diseases, where you maybe have a diagnosis that would impact your mental health, how would you cope with that? But there didn't seem to be so much of that. So initially, Chris, I'd love to hear your thoughts on that, and then I'd like to open that up to the wider group.
Yeah, sure, absolutely. So one of our assumptions going to the research, as Peter mentioned, is that we would find a lot of technologies that were focused on helping people from specific demographic groups or from specific age groups to help to deal with their mental health, or indeed for people that have rare diseases or diabetes to be assisted with their mental health support. What we actually found was happening is that a lot of these groups would be referred to more generic mental health interventions or support mechanisms to help them handle it. It's really interesting to consider why that might be the case and why that opportunity is not necessarily being seized upon. One of the things we highlighted in the report is that it might have to do with, exactly, with profit, and the fact that if you're targeting a smaller group, you have potentially less revenue and less people using your product. But I'm really keen to hear other panelists' ideas on why that might be the case as well, or whether you think there's not enough research that is being done, or indeed if you have seen technologies that are working in those spaces that perhaps weren't captured in our report.
Please do jump in, Dan. Oh, I think you're
sorry.
Oh,
I'll go. Sorry, I thought Dan was going to go. No, thanks for that, Chris. I think that was really interesting. I think from my point of view, what I think kind of stood out on your point there as well is to understand maybe a little bit more about how technology has to complement some level of human intervention as well. Because there's one degree of things being fully technology driven and actually being able to have some of kind of the same quality of care outcomes on the back of that, compared to actually kind of pure face-to-face talking therapies that you would traditionally get in mental health support. So I think I don't personally have a kind of companies or names that would be supportive of kind of that technology only drive and to understand even what their care outcomes are. But I think it's a really interesting point to think about how do we have to actually not just think about technology and not just think about people intervention, but how that's also combining with one another.
That's really useful. Dan, do you want to?
I've managed to find the unmute sign, so that's someone's got to do it, don't they? So as someone who's worked their entire life with bipolar disorder, so I'm diagnosed with bipolar disorder. I've never found a product that was really any good, and I've always had a real frustration over platforms and tools and even just general EAP systems out there because of just the reactive nature of what they are. And I think even up until just pre-pandemic, a lot of the acceptance of well-being, and to put it in that sort of strain is still very much of teaching people about yoga and breathing and sleep, and that doesn't solve the root cause of an issue, which is something that we do directly as well. Good, but does it really start understanding sort of what those trigger points are for depression, or does it start looking at how to prevent crisis? And unfortunately, there is, and put it into a business perspective, there is no tangible return on investment for teaching people how to breathe. There's no way of understanding how really you can match that to be able to be something that can be, beneficial to the business overall.
Lovely, thank you. Yeah, Zelia, please do come in.
Yeah, so I found that the biggest limitation that we have experience is simply financial, right? So when you do your deck and you're trying to get funding and you're not specifically applying to a specific grant, then you have to show how big is the market and then how many people can you address and everything. So it has to be very broad and very general. And I kind of found a way that I could do what I want to do and still address that. So we are addressing anxiety and depression, which are the two most widespread disorders, and I'm very interested in them. But at the same time, we have a very young target audience. And every time we get our investors or our clients going, yeah, but what happens if you're a child or if you're a 52-year-old person, you don't want to play a game, because we're specifically made for the needs and consumer habits of young adults, right? They say, okay, it's great for a 24-year-old or 32-year-old, but what happens with my 46-year-olds, And we're saying, okay, you can't do something generally that well for everyone. It's something very personal, and it has to be personalized. Even if you're the best therapist in the world, you're not going to be able to connect with every client, right? So there's different platforms that need to have different. So what we say is, okay, you can't cook the ocean, but you can take a bucket out of that and heat that up very well. And because we're quite broad on the diagnostics, they kind of allow us to get away with taking care of young adults. But on our roadmap, we have to put in, we're going to put games for kids, we're going to put games for adults and the geriatrics and everything. And then I'm going to like weasel my way to different disorders that I like PTSD or eating disorders. Okay, when I say like that, I'm personally interested in, and I think they need platforms. So it's really we're extremely limited by funding, and I think that's the biggest factor out there.
Thank you. I'd like to follow up with you actually, Zoe, on the gamification side of things, and particularly VR and immersive tech. I guess there are two roads you can go down with that, aren't there? You can either have controlled exposure to things to help people cope better, or you can have escapism and getting away from it. What do you use as your approach, and kind of what are your thoughts around those two areas?
I would say we're actually going a third route. So it doesn't sound quite as sexy, but I would say like we're psychoeducation on steroids, and that therapy is a large amount of psychoeducation, understanding why you react certain ways, being able to develop new pathways of beneficial reactions and thought processes, right? So the brain is really made for novelty, excitement, joy, and to learn in a narrative way. And that's what we're kind of harnessing. So we teach psychological skills, let's say like generalization, which is something that every population does, but it's very specific for depression and anxiety and can have a huge effect. Like one person doesn't like you and you generalize and say you are fundamentally unlikable. You can imagine what kind of an effect that has on your mental well-being and your mental health, right? So we use the gaming element to create the dopamine and the wow effect and this is different and exciting and we don't know what's going to happen next. And the narration of teaching the psychological skill and allowing people to be able to recognize it within the story and then within themselves as our carriers of mental health. And just allow me, so for I like to kind of compare it to a pharmaceutical. Every pharmaceutical, every medicine or drug you take has two main factors. The first one is the actual medicine, like for your heart disease, for example. And the second one is the carrier that makes sure that the heart disease medicine comes to the heart where it needs to be and it doesn't go to the kidney or to your brain or somewhere else. And gamification is the carrier for the psychoeducation and the intervention of our product.
That's really interesting. Thank you. There's a huge amount to unpack there. Yeah. But I think for the sake of time, I think we'll move through the panel and hear a few different perspectives. I just want to say thank you everyone who's putting questions in the chat. We'll get to those in a little bit, but please do put more in, and yeah, we'll look forward to addressing some of those in a few minutes. So Dan, do you want to take us through your general approach and where you end up looking between businesses versus consumers and some of the subtleties and differences between them?
Yeah, definitely. So as we know, there is a global mental health crisis, but it's not affecting just individuals, and the cost to the economy is about 45 billion pre-pandemic, according to Deloitte, and that was a year. So that equates to about 1.7K per employee per year, and that's the national average, and rises to about 3 grand in certain industries as well. And what that covers is things like presenteeism, absenteeism. It covers recruitment fees for increased staff churn, and so this cost is completely avoidable. And what we do, born out of 2 mental health crises. So my co-founder, he went through his own mental health crises. Born out of that, we actually thought to ourselves, is there anything out there? Is there any current solutions that look to prevent people from leaving work due to poor mental health? And so really what we've come to do is we help employers become better. We know that employees expect better employers. And so with our team of psychologists, with our team, we've got a data scientist from the Alan Turing Institute. So through our team, what we do is we look to survey staff and employees with our chatbot, and we're not an app, we're a service, and we go to communities where people are already talking. So WhatsApp, Microsoft Teams, Slack, all these different channels. And then based off all that data that we take on in an anonymous way, we then report back to an organization with real solutions, how to overcome any potential threats. And what that will look like is either we will propose solutions that they can actually go and act on very much on that day, or propose solutions that will be projects for them to be able to go and deliver. And the way that they go and deliver that is often with our partners. We like to collaborate with other organizations as well, because, you know, as we've just heard, there's so much out there, and mental health is so broad and so wide that you can't really just be able to get everything all in one. So what we do is we pair our consultancy very much at the beginning, you know, onboarding an organization, understanding their bespoke requirements, and then using our AI chatbot to be able to actually obtain that data. And we've seen huge returns on investment for organizations because we can actually track that back to performance, which is obviously a great thing.
Thank you, Dan. That's really interesting. And yeah, I think the integration with pre-existing technology is a really interesting approach. Vivek, I wanted to move on to ask about your perspectives directly in the care sector, because so far we've heard quite a few different stories across different groups of people, and I think everyone is very well aware that COVID-19 has had really profound effects on the care workforce. And I wanted to know how your processes have changed over the last year, and the way you're starting to think about workforce mental health as WEMA.
Yeah, thanks, Peter. Really good question. I think there's a few things that I just to kind of touch on around that, and also how that links back into the report that you released, because a couple of really interesting things came out of that. One, which was around the fact that there was a reduction in inquiries for mental health services over the previous year. However, that was converse against the number of people that actually needed additional mental health support. So that was clearly showing that people either didn't have access to the right services, or they weren't aware of what was available to them locally in their community. I think a couple of other things that were really interesting are things around digital inclusion and how we're including different members of populations. So something Celia mentioned as well earlier is around funding. If people are having to pay for stuff themselves, how are they actually then doing that? If they're going to do it through the NHS, then do they have a 6-month wait time in their local community through their local authority? So it's a really interesting mix there, and that then ties into the things that we try and do. And we work very heavily within the corporate space, and what we're basically trying to do is navigate people through a journey of understanding exactly what they need. Because another thing within mental health is that what type of therapy is actually most appropriate to your need. If I'm having to now download an app, or I'm being told, look, you have anxiety, you have depression, you need to go get an app. As a user, I've firstly got no idea about any kind of therapies, and then I have to now choose an app that apparently is the best place for me to deal with, and then I might have to pay for that as well. So all of these questions start arising, and as an individual, it's very difficult to make those decisions, especially when you're in quite a negative mental state. And actually to reach out to a GP or someone else isn't always the best experience anyway, because you're having to call, you get 2 minutes on the phone and they send you somewhere else. So it's a really difficult thing. But that's exactly where it becomes so important in the overall kind of navigation piece. So for example, like I say, that's what WEMA's doing. We go into organizations. The employees in those organizations have access to our concierge service, which takes their employees, whether it's a service for themselves or their loved one, through a process of assessment, care planning, and then actually coming up with a list of services that are most appropriate to their needs, and actually supporting them in the interaction or procurement of those services as well. And whether it's private insurance, private or S-funded, all of those covered in what to do. But that's exactly, I think, where we need to be taking this conversation a little bit more, Because the other thing there is what's happening with the elderly generation. Are they accessing stuff? Are there specific apps in line for the elderly population as well? And what's there that we should be looking to put forward? Again, like Celia mentioned, her app specifically is targeted towards a specific population of people, which is fantastic because that's exactly, she knows the group that she's trying to put that kind of support to. Otherwise, if you're trying to generalize everything, it's absolutely impossible. So I think the way the conversation needs to go on the back of the report, and actually the way businesses like us are trying to deal with these challenges, is become fairly niche in what we're trying to do. Think about how it's supporting a specific group of individuals. If there's ways we can then tailor it to other groups of people within that and actually put it forward to, for example, if you're looking at depression and then you need to look at kind of PTSD or something else, you can do that. But at least have that more specific nature towards the technology. And like I said earlier, is how is that also now combining with a people-driven service? Are there combinations of the two? As Dan mentioned, he had previously tried to use mental health apps in the past and actually found them completely useless because they're giving you predetermined responses to things that you're trying to talk about, which aren't necessarily the most appropriate thing for you to be hearing at that time, or it's not the most appropriate bit of support. So these are the things that I think, if we can get right moving forward, and if I'm now looking at that in a corporate space, I think everyone's mentioned here around the cost of businesses, the effect it's having on employees, and those challenges associated with that. That's then when firstly employers are going to see improvement in ROI, and then the employees themselves are going to feel welcomed and comfortable in that working environment. And like everyone's mentioned, the funding's the hardest thing. And I think for all of us businesses here today, we are selling to corporates. Corporates have to see an ROI, otherwise they're never going to sign anything off, especially in today's market. But how can you actually quantify what that ROI looks like when a lot of these things aren't quantitative, they're qualitative, they're an improvement in someone's mood? What price can you actually put on that? You're going to be putting a price based on, okay, they've improved a mood, which now relates to improved productivity, which relates to X amount of pounds because they've not wasted 2 hours in their day. But actually, what is the overall value of that person's well-being? And these are the things that are impossible to get across to investors and to businesses and all those other things. But if there's a way that it can be demonstrated, or even if people have that feeling of, I actually need to just support, I don't need to see I'm going to get a 6-time ROI and that's going to relate to X, Y, Z. It's actually putting businesses and people first alongside everything else that's going on in today's market. So, I mean, there's a lot of things within there that I've probably touched on and it's fairly scattered. But I hope that's given kind of our perspective, what WEMA thinks, and actually trying to relate it back to also the report, because there are so many interesting findings within that report that I think businesses like ours need to now utilize and take forward into our product and think about how it's actually going to benefit people at the end of the day, because that's why we're here.
Lovely, thank you for that, and thank you for your kind words on the report there. Chris, I know I'd spoken to you about an area previously, but there's loads of questions in the chat. So thank you everyone for submitting your questions. I don't think we're going to be able to get through all of them in this session. So I'll follow up with people individually afterwards as well for anything outstanding. But Chris, there's a really interesting question in the chat about whether there are people out there that are deploying other therapeutic models outside of CBT. We spoke about this while we were doing the research, and yeah, it'd be great to hear your thoughts on that in terms of whether you found many others there or whether it's something that's really missing that needs developing.
Outside of CBT, cognitive behavioral therapy, yes? Yeah, surprisingly, there weren't that many technologies that were being developed outside of that. It's interesting because obviously, and it relates to this point about sort of scaling, I guess, interventions that are known to already be effective, which is what a lot of technologies are focused on doing. And I guess it also relates to the fact that if you want to develop technologies to face new challenges, for example, post-COVID, or to do new things, you also need to raise the funding to be able to do so. But we found some companies that were doing some really interesting things with, VR headsets and AI as well. But really, there is a lot of scope to develop new technologies in that area. And some of the areas that that we highlighted might be interesting for technologies to be developed were, for example, in preventative care, where there is a lot of work already being done, but where there's an opportunity to target that further to specific demographic groups, at-risk groups, or to people that have specific conditions such as we mentioned, rare diseases or diabetes, but also for screening programs for people that are particularly at risk. So we had expected, for example, for NHS workers, for there to be a lot of tailored support for NHS workers that were doing sort of different things, and they weren't really doing it. And I think this is important because the scaling of care hasn't always been very effective. As has already been mentioned, there have been instances, particularly during COVID, where applications were made available to people, or applications were made available to NHS staff, and they didn't always reach out and use it. And this is where we need to consider what is the right technologies to develop, what is the appropriate technology that can support people. Particularly, I think human connection and continuity of care are really important elements here. So I think there's a lot more scope for development. But of course, the healthcare industry is tightly regulated and it's very risk averse, because if you get things wrong, the price can be very high to pay. So it's a difficult one. I hope that answers the question.
I think it does from my perspective. Are there any other thoughts from the panelists on that one? Celia, you've got your hand up.
Yes, so I kind of have a lovely relationship with cognitive behavioral therapy, because it's kind of like the way it's used often is more bandwidth, and often too little and too late. It's the full session. But at the same time, one of the reasons why we use cognitive therapy alongside positive psychology and systemic therapy is because it's what you call low-hanging fruit. It's easy to understand, it's easily implementable, and people feel the impact. Because there's a huge difference between having a lowering in anxiety and, clinically, by, I don't know, Cohen's 0.4, which is, a large effect size. Or if you go from feeling the difference and thinking, oh, I have another tool in my belt that I can use, and you're feeling empowered by it, right? And that happens very easily with cognitive behavioral therapy. So that people are like, oh my goodness, that makes so much sense. I'm going to use this, right? So it empowers them. And a lot of the other therapies are very time intense, and they're very interpersonal. So talking therapies, you're sitting there in the room, you're reading the person, you're asking the questions, you're using all your knowledge. That's something that potentially artificial intelligence would be able to do in 10, 15, 20 years, right? So if you get that wrong, you can really, really harm people, and it's too expensive to monitor all the AI. Unless you give me 50 million, I'll give you a good AI in like 3 years, right? But then I'm gonna have like 200 therapists recording every session and then coding everything that they said and why, right? So that a little bit about CBT and why it's so prevalent everywhere.
Oh, thank you, Sylvia. Dan, please do.
I think with us, we looked at the CBT sort of approach initially when we wanted to start working within organizations, and what we found is that it's incredibly reactive, and actually to be able to scale and automate something, through a chat system, for example, can be a real struggle. Exactly what Sylvia was talking about is from a technology point of view with CBT, what you have to have a different conversation every day. You have to learn differently, and just move forward. Then that's what happens in the real world. But for technology to be able to do that, it's really difficult. So for us, where we looked at it was to take a completely different approach and go really preventative through culture change. And so rather than attacking and looking at sort of the actual resolution of problems, we are looking at the root cause. So if there is a toxic manager within an organization, then we can identify there are issues. If there's systemic racism within an organization, which we are dealing with at the moment within one of our clients, then we can advise on that. And what the output of that is very much by overcoming those challenges, you'll see a reduction in anxiety, you'll see a reduction in stress, you'll see a reduction in depression. And we actually monitor this as well. And I will say as well, I see one of the points in the attendee questions, I was really surprised as well to hear that someone saw the reduction in referrals to mental health. What we've seen in our work that we do is there's been an incredible increase. And actually there was a study which we did at the beginning of lockdown, and we've continued it throughout, and we've seen that symptoms of depression within our workforces are gone up to about 64% of workers, which is well above national average. So yeah, I was really surprised about that. People have seen that decrease.
I'd just like to add, Peter, if that's all right. Yeah, I just to add to your point there, Dan, as well. I mean, from what we've seen over the last year, we started our product mainly focused around the informal care needs of the workforce, those that were acting as working carers. Obviously, a lot of the kind of cascade effects of being a working carer leads to mental health challenges. So many of the mental health kind of inquiries that we'd initially received when we started a couple of years back were to do with people who were struggling as working carers. But really, again, to the point on the fact that the report demonstrates that it decreased in referrals, we've seen over the last year, actually, we're now at about 50% of people inquiring to our service for working care challenges, and it's actually mental health themselves as employees, because they're suffering with things like isolation, anxieties, depression, and other things as well. So we've seen the increase and the change of the tides there as well. And probably, actually, if I looked at my numbers in the last couple of months, I would have probably seen that mental health for the employees themselves is even higher than the other services that we're now doing. So that's really interesting. And I also just wanted to add that I think the other good thing, and not to say many good things have come out of COVID, but a good thing that has actually come out of COVID is the drive that businesses, whether that's corporates or the drive that the actual service providers are now putting on implementing technology within their practice. It was previous, I mean, if I look at the social care space a couple of years ago, and not kind of touching on clinical mental health services or anything like that, looking at social care a couple of years ago, there was such a kind of a lack of interest in switching into a technology-driven model, whether that was just kind of managing services or actually delivering services to people as well. And it touches again on that point of digital inclusion. There's so many people that don't have access to anything. But now with the technology advancements that we've seen in the last year, they now do. They can speak to a counsellor through a video chat, and it's much easier to do that instead of having to go to your local hospital and have it in practice. Or you can kind of have online tools that, even if it's just a chatbot, because you're not comfortable in having a conversation with a person, you now have that kind of mechanism to do that. So I think Dan was going to say something, but I think that really has driven a lot of what we do in the right direction and allowed people to be a lot more flexible and innovative with the technology they're trying to now introduce as well.
Thanks for that, Dan. I think we might need to move on to some more questions because we're rapidly running out of time, which is a real shame. Because
sorry, I'd love to pick up something after then.
Let's pick it up after. But there are quite a few questions around gaps in the market and where technology isn't being provided and how we can support that. I know this was a big focus of our discussion, Chris. So what I'll probably get you to do is start off the discussion, then move on to the rest of the panelists to hear some of the things that they feel would be really useful interventions and things that would help them. So Chris, yes, some of your initial perspectives would be useful.
Yeah, absolutely. Let me just gather my thoughts. I mean, we have touched already on some of the technologies that could be developed, or where there is room certainly for research to happen. And we did speak with Professor Simon Wesley and with a clinician during the research for this report. So it was really great to get that clinician insight as well. I think whatever the next step is in terms of exploring different types of mental health technologies, it's just going to be really important to involve end users, clinicians, and patients, because they're ultimately the people that are going to really know what is needed in the real world, and are going to be able to provide the input and the feedback to make a product accessible and usable. And after that point, one would hope that scale and spread would follow. So whether you are looking to develop products that are more targeted to specific groups, or looking to improve your data collection so you can triage patients better and do that preventative piece, I think it's just really important to involve the patients and the end users as soon as possible to make sure that your product is as effective as it can be. And I'll hand over to the rest now.
Yeah, I completely agree with that. I'd second that. And yeah, it'd be really interesting to hear what sort of interventions, and if actually that sort of thing can be built into those interventions to make it easier for solution developers to reach wider markets. So Zelia, you've got your hand up, so I'll go to you first.
I think sometimes that psychologists and researchers get caught in what they've learned and what they know and what they think something should be, and that is proven, that it's really, really hard to look outside of the box and see new things. And that we don't have to reinvent the wheel, but we just have to see where is our target audience, what are they successfully using, and then we'll adopt that, right? So we learned the hard way. We had retention of 2% in month 1 of our evidence-based first application that could lower depression and anxiety levels up to the level of a beta blocker, no side effects. We thought people would be ripping that out of our hands. At the end of 4 weeks, we had 2% of the people still on it. So we're like, okay, either I made a really shitty app or we're doing something wrong, which was a bit of both. Anyway, so what we're doing is we said, the target audience, where are they? What are they doing? Like, if you're depressed and you're not getting up and taking a shower, what are you doing instead? You're either watching Netflix, you're playing a game, or maybe you're reading a book or a comic or something like that. Gaming is about 20 years in advance in behavioral psychology for game-specific triggers and things like that. Why don't we use that to make it easier and fun and more engaging to stick to something that's good for you? It's kind of like making medicine for kids taste like sugary stuff. I don't know if you guys have kids. We have 1-year-old twins. They have Calpol, which is like a paracetamol. They love that stuff. I bring out the medicine. They're like, that's what you have to do for mental health. And having unusual industries come together to, work together to find that kind of solution makes a lot of sense.
It touches on the points again of finding or producing products that are very relevant to specific groups of individuals. Because if you think about every even age group and generational differences between from an individual who's suffering from depression who's 18 compared to someone who's 60, the triggers of those issues are going to be so different. As someone who's 18 might be because they've spent their life on social media and they've been bullied or other issues around that. Someone who's 60 might have lost a parent. And again, it's such a different reason as to why they might be feeling what they're feeling. The way then they'll be behaving will be very different to one another as well on the back of that. And then the way they're going to engage with a product is going to be hugely different, because a gamification app might be great for someone that is young and is really interested in that. Maybe they game on the side with their friends, but a lot of the reason why they're not feeling great is because a lot of that stopped, or they've lost friends, or whatever it might be, compared to someone who's older, who's actually not interested in using a phone, might be more interested to actually just have a conversation with someone or open up in a different way. So I think the whole point on being able to scale these different products, again, is going to come down to what market segment are they trying to scale into? And actually, what is that product really trying to address within that market segment? And then how is it going to deliver against that? As we all know, CBT is all to do with thoughts, feelings, beliefs. Thoughts, feelings, behaviors. And they're also stemming from kind of belief systems that you have internally. So again, they're going to be so different for so many different people that the whole point on kind of a depression-wide app that's going to cover everyone is impossible to achieve. But I really think that's where the NHS is also trying to take it, where the way they've opened up the NHS App Store to lots of different apps, they've opened up the kind of mental health records to lots of different providers now. Although I don't know how true it is, they are trying to promote smaller businesses and smaller companies to get involved. Exactly, Celia. But there is a drive on that, and it has changed in the last 5 odd years to where it is today. And hopefully we do see a progression of that moving forward with more businesses like ours getting involved.
Cool, thank you. Dan, did you have a last thought? We're about to...
Yeah, I think. Sorry, that's my dog. I think just to reiterate and to sum up in that way, you to be generic and just to try and push everyone into one place is you're not going to get the adoption rates that you really want. And a point that one of the questions has come in is like digitization can be really stressful for some. And it's really burdensome for individuals as well, which is why you need to go to those communities where they actually are. And, you know, whether it's on WhatsApp, whether it's through SMS as an example, or Microsoft Teams or Slack, or which I'm just using chat, you know, sort of solutions as an example, because that's where we are. We've decided not to go down the app route because no one wants to download another app to not use another day. In fact, where we're going is very much where everyone already is. So we'll just have a chat with them in those communities. And so we find that very much we get a lot more onboarded because of that. And that way you're not being generic. That way you are being more direct, and you're able to help those who aren't just, you know, the early adopters, who are, you know, firing left, right, and center on from a digital point of view, but you're able to help those, you know, who are more laggard on that scale.
Lovely, thank you. We're rapidly running out of time, and there are some amazing questions in the chat, and also some really nice comments about the research. So thank you all for your kind feedback there. We will follow up individually on some of those questions as well. But in terms of some other themes that we haven't been able to explore here, there were questions around risk assessments for return to work after COVID, some thoughts around specific types of technology themselves and how we can support access to that. Then also, obviously, the skills and workforce engagement question, how we get people upskilled and build it into training, and particularly digital solution provision into that training. So thank you everyone who submitted a question, and thank you to our excellent panelists. It's been a really interesting discussion. I wish it could go on a lot longer. So yeah, I just wanted to thank you everyone for joining, and please do come to our next event, which will be launched soon, I believe, unless Simon's already pushed up. He's very proactive. And a final huge thank you to our sponsor, Weema. It's great to be working with them, and yeah, it makes all these sorts of events possible. So yeah, see you all soon, and thank you very much.